These people are absolutely amazing, for they share their personal stories to break down stigma and to create awareness around mental health. But when we think of somebody who is sad, they look that way. But can you tell that they are actually diagnosed with a mental illness? This is an important statistic to remember. 1 in 4 people will be diagnosed with a mental illness or a serious mental health condition in their lifetime. If it isn't you that is affected, then often it's somebody you know or care about, and it's important to learn about this stuff. If you want to know what mental illness looks like, well, it looks like me. I have bipolar disorder. I'm here today to share my personal story with you. I share it in a very candid, open, and non-sugar-coated manner. I feel that it's really important to talk about our personal stories, and I want to share mine in the most honest way possible. And before I share my personal story, I feel it is very important to go over some mental health education where we talk about various mental illnesses.
My name is Dr. Dana Wasserman, and I'm a registered psychologist here in Vancouver, British Columbia. Bipolar disorder is a not uncommon mental disorder that's marked by changes in mood and energy, and it's marked by cycles. So it comes with 2 phases, essentially. We have a manic phase, and then we have a depressive phase. I should say that if anybody ever says to you, oh, everybody's bipolar, no, that's not true. We all have moods. Sometimes they're kind of up, we're feeling great. Sometimes we're not feeling so great. That's normal mood fluctuation. With bipolar disorder, however, we're talking about a completely different magnitude. So, for example, when we have a manic episode, it's marked by impulsive, risky behavior. Your thoughts might be racing, your speech might be really, really fast, you might be really, really irritable with people. Sometimes it can be so severe that people can become psychotic, that is, they can have a break with reality. After that happens, for many people with bipolar disorder, they then crash into a depressive episode. And that's exactly what it sounds like. Rather than being up and elated and just racing, people become slow. They feel sad and empty. So we have this enormous up, this enormous down, and this cycle continues. And it's tough to deal with, but it can be managed. Even though depressive episodes are part of bipolar disorder, depression is its own entity. It's its own disorder. Hallmark symptom, sad, empty mood for at least 2 weeks. Because we all get sad moods sometimes. But if the sad mood is persistent and lasts more than 2 weeks, perhaps we have something going on here. There may be changes in appetite. We might lose our appetite. We might have a huge increase in appetite and eat a lot. In terms of sleep, for some people with depression, they may sleep a whole lot. Other people may have incredible trouble sleeping at all. There may be feelings of intense worthlessness, hopelessness, guilt. We're talking about deep, heavy, crushing sadness. I'm talking about crushing guilt that makes it hard for us to do our everyday activities. Psychosis isn't a mental disorder unto itself. Rather, psychosis is a condition that's marked by a loss of connection to reality. Issues with seeing, hearing, and believing. Psychosis involves something called a hallucination. If I'm sitting in here and I hear dogs barking, but nobody else hears dogs barking, there might be something to it. Less common is the visual hallucination, which is exactly how it sounds, that I might be seeing things that aren't really there. And the other aspect of psychosis is a delusion, which means false beliefs. And there are many different kinds of delusions. One kind of delusion is like a delusion of grandeur. When I grow up, I'm going to be a famous movie star. Even though I have absolutely no talent in acting, no talent in singing, or anything like that. Schizophrenia is a serious mental disorder that significantly affects thinking and feeling and beliefs. There are negative symptoms, there are positive symptoms, and there are cognitive symptoms. So for obsessive-compulsive disorder, we start with, well, obsessions, which are repetitive, constant thoughts. Typically, these thoughts cause anxiety, and they can be anything from a fear of contamination by germs. They could be fear of having thoughts that are forbidden or that we might get in trouble from. If someone has a fear that their bathroom's been contaminated, the compulsion might be to clean that bathroom for hours and hours until that anxiety goes away. The problem is that anxiety doesn't really go away for long, and therefore a cycle starts. Generalized anxiety disorder is a mental disorder that is characterized by worry. Worry is normal, worry is natural. I'm talking about a completely different level of worry. I'm talking about daily, intense worry for at least 6 months. I had to reach out for help for my diagnosis. And if I didn't, I think my life would be really bad right now. And even as a psychologist, the whole idea of coming to someone and saying, I need help, was absolutely terrifying. Why? Because of a stigma that has existed for mental disorders. I want that stigma gone. I wouldn't say this if I had a broken arm. So I think the most important thing is that there is help. It's there for you. And if I can do it, even in my profession, then you can do it too. I am confident that I do better work now as a psychologist than I ever did before when I wasn't treated. So again, I want to reiterate to everyone that there is hope and there is help.